1. What is the primary purpose of hand hygiene in nursing practice? A. To improve patient comfort. B. To prevent the spread of infection. C. To reduce hospital costs. D. To enhance staff morale. Answer. To prevent the spread of infection. Rationale. Hand hygiene is the most effective way to stop germs from spreading between patients, staff, and surfaces. It's a key infection control measure. Option A helps comfort, but isn't the main goal. Option C may happen indirectly, but isn't primary. Option D is unrelated to the core purpose. 2. Which action should a nurse take first when a patient falls out of bed? A. Call for help immediately. B. Assess the patient for injuries. C. Move the patient back to bed. D. Notify the physician. Answer. Assess the patient for injuries. Rationale. The nurse's first step is to check the patient for harm, like bleeding or broken bones, to decide what to do next. Option A is next if needed. Option C risks further injury, without assessment. Option D comes after initial care. 3. How should a nurse communicate with a patient who is hard of hearing? A. Speak loudly and quickly. B. Face the patient and speak clearly. C. Use written notes only. D. Ask a family member to interpret. Answer. Face the patient and speak clearly. Rationale. Facing the patient helps them lip read and hear better, ensuring clear communication. Option A can distort words. Option C limits interaction. Option D isn't ideal, as family may not relay accurately. 4. What is the best way to prevent infection when changing a wound dressing? A. Wear gloves only. B. Use sterile technique. C. Wash hands after the procedure. D. Apply antiseptic to the wound. Answer. Use sterile technique. Rationale. Sterile technique keeps the wound free of germs during dressing changes, preventing infection. Option A isn't enough alone. Option C is too late. Option D helps, but isn't the primary method here. 5. Which vital sign should a nurse check first in a patient with chest pain? A. Blood pressure. B. Pulse rate. C. Respiratory rate. D. Temperature. Answer. Respiratory rate. Rationale. Chest pain could mean breathing trouble, so checking respiratory rate first assesses airway and oxygenation, top priorities. Options A and B are next. Option D is less urgent here. 6. What should a nurse do to respect a patient's confidentiality? A. Discuss care in a private room. B. Share details with all staff. C. Leave charts open at the desk. D. Talk about the patient in the hall. Answer. Discuss care in a private room. Rationale. Privacy protects patient info under laws like HIPAA. Option A ensures this. Options B, C, and D breach confidentiality by exposing details to others unnecessarily. 7. How should a nurse assist a patient with limited mobility to the chair? A. Lift the patient alone. B. Use a gait belt and help them stand. C. Push the patient in a wheelchair. D. Tell them to walk slowly. Answer. Use a gait belt and help them stand. Rationale. A gait belt ensures safety and support for both patient and nurse during transfers. Option A risks injury. Option C assumes a wheelchair, not specified. Option D ignores assistance needs. 8. What is the nurse's role in teaching a patient about a low-sodium diet? A. Give a list of foods to avoid. B. Explain why sodium is restricted. C. Cook meals for the patient. D. Refer them to a dietitian only. Answer. Explain why sodium is restricted. Rationale. Education empowers patients to follow diets by understanding the reason, like heart health, not just rules. Option A lacks depth. Option C isn't practical. Option D skips the nurse's teaching role. 9. Which step ensures safe medication administration? A. Check the patient's ID band. B. Give meds based on room number. C. Skip the dose if unsure. D. Ask a coworker to verify. Answer. Check the patient's ID band. Rationale. Verifying ID with two identifiers, name, birth date, prevents errors per the rights of med administration. Option B risks mix-ups. Option C delays care. Option D isn't standard protocol. 10. What should a nurse include in a patient's daily hygiene care? A. Bathing and oral care. B. Changing bed linens only. C. Brushing hair only. D. Offering a back massage only. Answer: bathing and oral care. Rationale: bathing and oral care are core hygiene tasks to keep patients clean and prevent infection. Option B is environmental, not personal care. Options C and D are incomplete on their own. 11. What is the primary purpose of hand hygiene in nursing practice? A. To improve patient comfort. B. To prevent the spread of infection. C. To reduce hospital costs. D. To enhance staff morale. Answer: to prevent the spread of infection. Rationale: hand hygiene is the most effective way to stop germs from spreading between patients, staff, and surfaces, making it a cornerstone of infection control. Option A may be a side effect but isn't primary. Option C is indirect. Option D is unrelated to the main goal. 12. Which action should a nurse take first when a patient falls out of bed? A. Call for help immediately. B. Assess the patient for injuries. C. Move the patient back to bed. D. Notify the physician. Answer: assess the patient for injuries. Rationale: assessing for injuries, like fractures or bleeding, is the priority to determine immediate needs and avoid harm. Option A follows if needed. Option C risks worsening injuries. Option D comes after assessment. 13. How should a nurse communicate with a patient who is hard of hearing? A. Speak loudly and quickly. B. Face the patient and speak clearly. C. Use written notes only. D. Ask a family member to interpret. Answer: face the patient and speak clearly. Rationale: facing the patient aids lip reading and clarity, improving communication. Option A distorts speech. Option C limits interaction unnecessarily. Option D may lead to inaccurate relay of information. 14. What is the best way to prevent infection when changing a wound dressing? A. Wear gloves only. B. Use sterile technique. C. Wash hands after the procedure. D. Apply antiseptic to the wound. Answer: use sterile technique. Rationale: sterile technique prevents introducing germs to the wound, reducing infection risk. Option A alone isn't sufficient. Option C is too late. Option D supports, but isn't the primary prevention method. 15. Which vital sign should a nurse check first in a patient with chest pain? A. Blood pressure. B. Pulse rate. C. Respiratory rate. D. Temperature. Answer: respiratory rate. Rationale: chest pain may signal respiratory distress, so checking breathing first ensures airway and oxygenation are addressed. Options A and B follow. Option D is less urgent in this scenario. 16. What should a nurse do to respect a patient's confidentiality? A. Discuss care in a private room. B. Share details with all staff. C. Leave charts open at the desk. D. Talk about the patient in the hall. Answer: discuss care in a private room. Rationale: privacy protects sensitive info, aligning with laws like HIPAA. Option A ensures this. Options B, C, and D violate confidentiality by exposing details to unauthorized people. 17. How should a nurse assist a patient with limited mobility to the chair? A. Lift the patient alone. B. Use a gait belt and help them stand. C. Push the patient in a wheelchair. D. Tell them to walk slowly. Answer: use a gait belt and help them stand. Rationale: a gait belt provides safe support for transfer, protecting both patient and nurse. Option A risks injury. Option C assumes equipment not mentioned. Option D neglects needed assistance. 18. What is the nurse's role in teaching a patient about a low-sodium diet? A. Give a list of foods to avoid. B. Explain why sodium is restricted. C. Cook meals for the patient. D. Refer them to a dietitian only. Answer: explain why sodium is restricted. Rationale: explaining the reason, like reducing heart strain, helps patients understand and adhere to the diet. Option A lacks context. Option C isn't feasible. Option D skips the nurse's teaching duty. 19. Which step ensures safe medication administration? A. Check the patient's ID band. B. Give meds based on room number. C. Skip the dose if unsure. D. Ask a coworker to verify. Answer. Check the patient's ID band. Rationale. Verifying ID with two identifiers, e.g., name, birth date, follows the rights of medication safety, preventing errors. Option B risks mix-ups. Option C delays care. Option D isn't standard. 20. What should a nurse include in a patient's daily hygiene care? A. Bathing and oral care. B. Changing bed linens only. C. Brushing hair only. D. Offering a back massage only. Answer. Bathing and oral care. Rationale. Bathing and oral care are essential for cleanliness and infection prevention. Option B is environmental, not personal hygiene. Option C and D are partial and insufficient alone. 21. What is the best way to prevent falls in an elderly patient? A. Keep the bed in a high position. B. Ensure clear walkways and use a call bell. C. Leave the lights off at night. D. Remove all mobility aids. Answer. Ensure clear walkways and use a call bell. Rationale. Clear paths and a call bell reduce tripping and assist safely, key for fall prevention. Option A increases fall risk. Option C impairs vision. Option D limits safe movement. 22. Which action should a nurse take when a patient refuses a bath? A. Force the bath for hygiene. B. Respect the refusal and document it. C. Skip documentation. D. Tell the family to convince them. Answer. Respect the refusal and document it. Rationale. Patients have the right to refuse care. Respecting this while documenting protects autonomy and legal standards. Option A violates rights. Option C skips accountability. Option D shifts responsibility. 23. How should a nurse position a patient after hip surgery? A. On their stomach. B. With legs abducted and straight. C. In a fetal position. D. Sitting upright fully. Answer. With legs abducted and straight. Rationale. This position prevents hip dislocation post-surgery by keeping the joint aligned. Option A risks injury. Option C strains the hip. Option D isn't feasible immediately. 24. What should a nurse do first when entering a patient's room? A. Wash hands. B. Greet the patient. C. Check the chart. D. Adjust the bed height. Answer. Wash hands. Rationale. Hand washing prevents germ spread, making it the first step for safety. Option B follows. Option C delays hygiene. Option D is situational, not priority. 25. Which precaution is used for a patient with MRSA? A. Droplet precautions. B. Contact precautions. C. Airborne precautions. D. Standard precautions only. Answer. Contact precautions. Rationale. MRSA spreads via touch, so contact precautions, gloves, gown, are needed beyond standard measures. Option A is for respiratory spread. Option C is for airborne germs. Option D isn't enough. 26. What is the nurse's priority when a patient's BP drops suddenly? A. Raise the head of the bed. B. Check the pulse and breathing. C. Call the doctor immediately. D. Give fluids without an order. Answer. Check the pulse and breathing. Rationale. Assessing vital signs first determines the severity and guides action for hypotension. Option A may worsen it. Option C delays assessment. Option D is unsafe without orders. 27. How should a nurse document a patient's pain level? A. Write patient is in pain. B. Use a pain scale and quote the patient. C. Guess based on behavior. D. Leave it blank if unsure. Answer. Use a pain scale and quote the patient. Rationale. Objective scales, e.g., 0 to 10, and patient words ensure accurate, legal documentation. Option A is vague. Option C is subjective. Option D omits critical data. 28. What should a nurse teach a patient to prevent pressure ulcers? A. Stay in one position longer. B. Change positions every 2 hours. C. Avoid using pillows. D. Eat fewer calories daily. Answer. Change positions every 2 hours. Rationale. Repositioning relieves pressure on skin, preventing ulcers. Option A increases risk. Option C reduces comfort. Option D is unrelated to pressure relief. 29. Which right ensures proper medication administration? A. Right time only. B. Right patient, drug, dose, route, time. C. Right nurse. D. Right room number. Answer. Right patient, drug, dose, route, time. Rationale. The 5 rights ensure safety and accuracy in med administration. Option A is incomplete. Option C isn't a right. Option D risks errors without ID checks. 30. What is the nurse's role in promoting patient autonomy? A. Make all decisions for them. B. Provide info for informed choices. C. Ignore patient preferences. D. Limit family involvement. Answer. Provide info for informed choices. Rationale. Autonomy means patients choose based on clear info, which nurses facilitate. Option A undermines it. Option C dismisses rights. Option D isn't directly related. 31. What should a nurse do first when a patient reports nausea? A. Offer a snack immediately. B. Assess the nausea's onset and severity. C. Administer an antiemetic. D. Notify the physician. Answer. Assess the nausea's onset and severity. Rationale. Assessment is the first step to determine the cause and severity of nausea, guiding further action. Option A may worsen it. Option C needs an order and assessment first. Option D follows assessment. 32. Which technique ensures proper hand washing and infection control? A. Wash for 10 seconds. B. Scrub hands for at least 40 to 60 seconds. C. Use cold water only. D. Dry hands with a cloth towel. Answer. Scrub hands for at least 40 to 60 seconds. Rationale. Scrubbing for 40 to 60 seconds removes germs effectively per CDC guidelines. Option A is too short. Option C is less effective. Option D risks contamination. Paper towels are preferred. 33. How should a nurse respond to a patient asking about their diagnosis? A. Say it's not the nurse's job. B. Provide clear, simple info within scope. C. Tell them to wait for the doctor. D. Give a detailed medical explanation. Answer. Provide clear, simple info within scope. Rationale. Nurses educate within their scope, aiding understanding and autonomy. Option A dismisses responsibility. Option C delays info. Option D risks overstepping into physician territory. 34. What is the safest way to transfer a patient from bed to a stretcher? A. Slide them without a device. B. Use a transfer board with assistance. C. Lift them alone with arms. D. Ask the patient to scoot over. Answer. Use a transfer board with assistance. Rationale. A transfer board and help ensure safety, reducing injury risk to patient and nurse. Option A is unsafe. Option C risks strain. Option D may not be possible for all patients. 35. Which findings should a nurse report immediately when taking vital signs? A. BP of 120/80 mmHg. B. Pulse of 110 beats per minute. C. Temp of 98.6 degrees Fahrenheit. D. Respirations of 16 per minute. Answer. Pulse of 110 beats per minute. Rationale. A pulse of 110 is tachycardic, normal 60 to 100, signaling potential distress needing urgent report. Options A, C, and D are normal and not immediate concerns. 36. What should a nurse do to maintain patient privacy during a bath? A. Leave the door open for safety. B. Cover the patient with a blanket. C. Invite family to assist. D. Discuss care with a colleague nearby. Answer. Cover the patient with a blanket. Rationale. Covering maintains dignity and privacy during care. Option A exposes the patient. Option C isn't always needed. Option D breaches confidentiality if overheard. 37. How should a nurse assist a patient with feeding who has weak hands? A. Feed them entirely. B. Provide adaptive utensils and supervise. C. Leave food for them to manage. D. Tell them to ask family for help. Answer. Provide adaptive utensils and supervise. Rationale. Adaptive utensils promote independence, while supervision ensures safety and intake. Option A reduces autonomy. Option C risks malnutrition. Option D shifts responsibility improperly. 38. What should a nurse teach a patient to improve respiratory health? A. Breathe shallowly to conserve energy. B. Practice deep breathing exercises. C. Avoid all physical activity. D. Sleep flat without pillows. Answer. Practice deep breathing exercises. Rationale. Deep breathing improves lung expansion and oxygenation, aiding respiratory health. Option A worsens function. Option C is too extreme. Option D may hinder breathing comfort. 39. Which action ensures accurate patient identification before a procedure? A. Ask the patient their name. B. Check 2 identifiers on the ID band. C. Use the room number. D. Confirm with a coworker. Answer. Check 2 identifiers on the ID band. Rationale. 2 identifiers, e.g., name, birth date, per policy ensure accuracy and safety. Option A relies on patient response, which may be unreliable. Option C risks errors. Option D isn't standard. 40. What should a nurse include in daily wound care documentation? A. Wound size, color, and drainage. B. Patient's mood only. C. Time of last meal. D. Nurse's opinion on healing. Answer. Wound size, color, and drainage. Rationale. Objective data like size, color, and drainage track wound progress legally and clinically. Option B is irrelevant. Option C is unrelated. Option D is subjective and incomplete. 41. What is the best way to prevent cross-contamination in a patient room? A. Reuse gloves between tasks. B. Change gloves between dirty and clean tasks. C. Wipe surfaces with water only. D. Leave equipment in the room. Answer. Change gloves between dirty and clean tasks. Rationale. Changing gloves prevents germ transfer between tasks, a key infection control step. Option A spreads germs. Option C is ineffective. Option D risks contamination spread. 42. Which patient right should a nurse uphold when giving a new medication? A. Right to refuse treatment. B. Right to extra doses if needed. C. Right to skip consent. D. Right to demand a different drug. Answer. Right to refuse treatment. Rationale. Patients can refuse meds, a legal right nurses must respect. Option A is correct. Options B, C, and D misrepresent patient rights and safety protocols. 43. How should a nurse position a patient to prevent aspiration during feeding? A. Flat on their back. B. Sitting upright at 60 to 90 degrees. C. Lying on their side fully. D. Head slightly tilted back. Answer. Sitting upright at 60 to 90 degrees. Rationale. Upright positioning uses gravity to prevent food from entering the airway, reducing aspiration risk. Option A increases it. Option C is less effective. Option D risks choking. 44. What should a nurse do first when noticing a medication error? A. Tell the patient immediately. B. Assess the patient for effects. C. Hide the error from the team. D. Change the medication record. Answer. Assess the patient for effects. Rationale. Assessing ensures patient safety by checking for harm from the error. Option B is first. Option A follows after assessment. Options C and D are unethical and unsafe. 45. Which isolation precaution is needed for a patient with tuberculosis? A. Contact precautions. B. Airborne precautions. C. Droplet precautions. D. Protective isolation. Answer. Airborne precautions. Rationale. TB spreads via air, requiring airborne precautions, e.g., N95 mask, negative pressure room. Option A is for touch spread. Option C is for droplets. Option D protects the patient, not others. 46. What should a nurse monitor in a patient with a new feeding tube? A. Tube placement and tolerance. B. Patient's weight only. C. Room temperature. D. Family visiting hours. Answer: tube placement and tolerance. Rationale: monitoring placement, e.g., pH check, and tolerance, e.g., nausea, ensures safety and nutrition. Option A is key. Options B, C, and D are secondary or unrelated. 47. How should a nurse respond to a family member asking about care plans? A. Share all details openly. B. Confirm patient consent first. C. Refuse to speak with them. D. Give vague, general answers. Answer: confirm patient consent first. Rationale: consent ensures privacy. Nurses must verify before sharing info. Option B upholds this. Option A breaches confidentiality. Option C is too harsh. Option D lacks clarity. 48. What should a nurse teach a patient to reduce constipation risk? A. Drink less water daily. B. Increase fiber and fluid intake. C. Avoid exercise completely. D. Take laxatives every day. Answer: increase fiber and fluid intake. Rationale: fiber and fluids promote bowel movement naturally. Option B is best. Option A worsens it. Option C reduces motility. Option D risks dependency, not prevention. 49. Which action prevents injury when using a mechanical lift? A. Operate it without training. B. Check the sling and weight limit first. C. Lift the patient quickly. D. Use it alone without help. Answer: check the sling and weight limit first. Rationale: checking equipment ensures safety and prevents falls or breakdowns. Option B is critical. Options A, C, and D increase injury risk due to lack of care or support. 50. What should a nurse include in a handoff report to the next shift? A. Patient's recent status and care needs. B. Personal opinions only. C. Gossip about the patient. D. Nothing if the chart is updated. Answer: patient's recent status and care needs. Rationale: a handoff report provides key info, e.g., vitals, meds, for continuity of care. Option A is essential. Options B and C are unprofessional. Option D risks gaps in communication.